Vibrio vulnificus. Vibrio vulnificus is also sometimes known as a non-cholera Vibrio, and the reason is because the most popular Vibrio is Vibrio cholera. So this is a different type, so that's why it's referred to as non-cholera Vibrio. So let's talk a little bit about this bug. It causes foodborne outbreaks of diarrhea, and if not treated properly, it can progress to septicemia. Now, how this is acquired is actually a very important part of the history of present illness. It involves inadequately cooked seafood, in particular shellfish and oysters. So raw oysters can sometimes be mentioned in the clinical vignette. An important point to mention is that alcoholics are particularly vulnerable of developing a serious Vibrio vulnificus infection because alcoholics oftentimes have pre-existing liver disease, and that can put a patient at risk. So let's talk a little bit about the presentation. What are the symptoms? It's essentially a enteric disorder, so it will present with abdominal pain and, very similar to cholera, watery diarrhea. Patient can also have nausea and vomiting, fever, chills. Some patients can also present with a rash, and because of the dehydration, the patient can also have low blood pressure. And of course, the dehydration is directly linked to the fact that they've lost significant amounts of fluids because of the watery diarrhea. Diagnosis? Usually the diagnosis is essentially just done by a history and physical exam, but you can also do blood cultures and stool cultures. Of course, this will help identify the organism. And in terms of a treatment, this can be treated with antibiotics, such as ciprofloxacin, or you can also use doxycycline. And of course, because of the immense fluid loss, volume repletion is definitely part of the treatment. So now let's take a look at a couple vignettes. 55-year-old man returns from a vacation to the beach. While on vacation, he and his family consumed several meals consisting primarily of seafood, including lobster and raw oysters. Although the other members of the family did not get sick, he developed a rash over his lower extremities, low blood pressure, hypotension, and confusion. His past medical history is significant for liver disease and alcoholism. Most likely cause of this man's signs and symptoms is... Well, they give you the history of the raw oysters, got a rash, low blood pressure, and he's particularly at risk because of his liver disease. And that all points to choice E, Vibrio vulnificus. And finally, 57-year-old fisherman with a history of alcoholism is hospitalized in Mississippi with a one-day history of severe watery diarrhea after eating several raw oysters. He's badly dehydrated on admission, and within 12 hours he becomes severely hypotensive and dies. Which of the following pathogens is the most likely cause of the man's death? Again, the clinical vignette encompasses all the aspects of an infection with Vibrio vulnificus, which would be choice E.